Welcome back to Have More Babies. I'm so glad you could join us today. We're taking a deep dive into an absolutely critical time for any new family. It's those first 4 weeks of a baby's life. People often call it the neonatal period. And, well, it's truly a golden window. So much happens. Today, we've got a fantastic source guiding us into the comprehensive guide on neonatal care from Omega Pediatrics, our mission. To really unpack what makes these first 28 days so crucial, we'll explore, the common challenges new parents might face and highlight how expert care and just parental involvement really set the foundation for a child's long-term health. Okay, let's unpack this.
It really is remarkable when you stop and think about it. Just the sheer amount of development and foundational health that gets established in such a short, concentrated time. And what's fascinating here, I think, is how much development and foundational health happens in such a short, concentrated time. It's not just about the baby adapting, it's the whole family system.
It is. The source really brings that out. And it highlights why we need to be, precise about this. So just to make sure we're all on the same page, what exactly does neonatal mean? Our source is quite specific about the time frame.
Yeah, and that precision is important. Neonatal specifically refers to the first 28 days of life, right from the moment of birth. It's a distinct window. Short, relatively speaking, but wow, it's packed with more milestones physiologically, developmentally than almost any other period of that length. The Omega Pediatrics guide really emphasizes this isn't just about getting through those first weeks. It's about laying down the essential groundwork, for robust long-term health.
For thriving.
Thriving for years to come. That really puts a different spin on it, doesn't it? Beyond just survival. So the guide breaks down why it's so critical into, I think they call them 3 key pillars. Could you walk us through those? Because here's where it gets really interesting. It's not just physical. Absolutely. So the first pillar, the one most people think of, maybe, is immune system development. You see, inside the womb, the baby's protected by the mother's antibodies, largely. But after birth, that passive immunity fades. Their own system, it's brand new. It has to ramp up incredibly quickly. It's not just underdeveloped, it's actively learning. And this initial programming, in those first 28 days, shaped by everything: environment, good bacteria from mom, skin to skin, feeding. It can massively influence things later, like susceptibility to infections, allergies, even autoimmune stuff. It's learning friend from foe, basically, which makes them pretty vulnerable right at the start.
Like its first intensive training camp, right?
Yeah.
And nutrition must be absolutely central to fuel all that.
Yeah.
And just general growth.
Oh, absolutely central, which is pillar number 2, nutritional needs. And it's not just general growth. It's incredibly specific, rapid growth, especially the brain. A newborn's brain, it actually doubles in size in the first year. And a huge chunk of that explosive growth happens right here in these first few weeks. So that demands really precise, consistent intake. Calories, specific fats like DHA, other micronutrients, things that are uniquely packed into breast milk or, formulas designed to mimic it closely. Any hiccups here, any feeding struggles, they can have real impacts, immediate and potentially long-lasting, on everything from brain development to organs.
Wow. Puts a whole different weight on every feeding session.
Yeah.
Okay, and the third pillar. This one feels like it gets to the heart of it all, emotionally.
It really does. The third crucial factor is bonding. And this is, it's way beyond just feeling loved. Early bonding, that consistent responsive care, skin to skin, talking, eye contact, it literally shapes the baby's brain architecture. Research shows these interactions trigger oxytocin, the love hormone, in both parent and baby. This helps regulate stress hormones like cortisol, builds pathways for emotional resilience, sets the stage for social skills, secure attachment, lasting a lifetime. The guide does a great job showing how these 3 things, physical health, nutrition, emotional bonding, they're all tangled up together, interconnected, building that robust foundation.
It's incredible how they all weave together. Okay, so it's a time of amazing development, this golden window.
Yeah.
But it can also come with challenges.
Yeah.
Our source from Omega Pediatrics mentions several common issues parents and babies might run into. What should families be aware of?
That's a really important point. Yes, while many babies sail through, it's common to hit some bumps. The guide highlights a few key ones. First, jaundice. That's the yellowing of the skin and eyes. It's from high bilirubin levels. Bilirubin's just a normal byproduct of breaking down red blood cells. An adult liver handles it fine, but a newborn's liver, still maturing, sometimes it can't keep up right away. So you get this temporary buildup. Most cases are mild physiological jaundice. They resolve on their own. But really high levels, in rare cases, can be serious, affecting the brain. That condition is called kernicterus, which is exactly why monitoring and sometimes treatment like phototherapy are so critical. Then you often see feeding difficulties. This can look like a lot of things. Trouble latching for breastfeeding, maybe issues with mom's milk supply coming in, or perhaps problems with formula. Getting enough nutrition is just non-negotiable for a neonate. So any struggle needs careful assessment, support, often from lactation consultants or pediatricians. You can imagine you're a new parent, sleep deprived, baby's not eating well, it's stressful. That support piece is huge. We also sometimes see respiratory problems. A common one is transient tachypnea, basically rapid breathing. Often happens after C-sections or really fast births. Some fluid might remain in the lungs because they didn't get that squeeze through the birth canal. Usually clears up on its own in a day or two as the fluid gets absorbed. But, you need to monitor carefully, make sure oxygen levels are okay, rule out anything more serious. And finally, infections. Like we talked about with the immune system just getting started, babies are just much more susceptible. Could be something localized, like around the umbilical cord, or more serious systemic infections, bacterial or viral. And because their immune response is immature, infections can move really fast, needs prompt medical attention. The stakes are just higher. So this raises an important question. How are these challenges typically identified and addressed?
That's the perfect transition from knowing the problems to understanding, well, the solutions. So when these issues pop up, how do doctors and nurses actually diagnose and treat these tiny patients? The Omega Pediatrics source mentions routine checks and specific treatments.
Right. It's a mix of really careful routine monitoring and then highly tailored treatments, always considering how unique newborn physiology is. For monitoring, the guide points out how crucial consistent tracking of weight and height is. It's not just numbers on a chart, it's about growth velocity. Healthy patterns tell you a lot about overall health, nutrition. A sudden drop or plateau, that signals something needs looking into fast. Blood tests are also key, especially for things like jaundice, where you need that precise bilirubin level to decide on treatment. They're also used for those universal newborn screenings, checking for a whole panel of rare but serious conditions. Things that, if you catch them early, you can manage and prevent long-term problems. And very importantly, hearing and vision tests. Done early to catch any sensory issues that could impact development down the line if they're missed. Early intervention for hearing or vision loss makes a massive difference for language, for cognitive development. It's all about early detection.
And when treatment is needed, it sounds like it's definitely not one size fits all. There's a lot of precision involved, isn't there?
Oh, absolutely not one size fits all. Treatments have to be uniquely tailored. Their systems are just so delicate, so immature. For jaundice, like we mentioned, phototherapy is common, very effective, non-invasive. Special blue lights help break down the bilirubin in the skin so the baby can excrete it easily. Simple, but powerful. For nutritional needs, if there are feeding issues or specific conditions, maybe specialized feeding plans come into play. Could be different techniques, special formulas, maybe adding fortifiers. In complex cases, sometimes even temporary tube feeding to make sure they get enough calories without working too hard. And for bacterial infections, yes, antibiotics, but always with extreme care. Dosing is super precise based on weight. The choice of antibiotic has to consider their immature kidneys and liver. Often they'll start with broad coverage while waiting for test results, then narrow it down. It's a constant balancing act, effectiveness versus safety in these tiny patients.
It really sounds like this incredible dance between close observation and very precise action. But throughout all this high-tech care, the parents, their role is just absolutely central, isn't it? The source says they're more than just caregivers. So what does this all mean for the parents during this intense golden window?
It means they're completely indispensable. Yeah, the Omega Pediatrics Guide really hammers this home, people. Parents are active partners in care, not just bystanders. Beyond the obvious physical stuff, feeding, changing, safety, their involvement in that emotional bonding piece is foundational. Things like consistent skin-to-skin, kangaroo care they call it, talking, singing, reading, just responding quickly to their cues. It profoundly impacts the baby's development, emotionally, psychologically. These interactions help regulate the baby's heart rate, breathing, temperature, promote better sleep, trigger those bonding hormones. It's not just the medical team, it's this partnership. Constant, loving parental interaction is driving so much of the baby's progress.
So it's not just about the baby getting care, but just as much about the parents getting the support and, well, the education they need to feel confident.
Exactly, yes. The source makes it really clear. Comprehensive neonatal care has to include support and education for parents. Could be practical stuff, feeding tips, learning baby cues, knowing warning signs, or just navigating the huge emotional shift of becoming a parent. Parents are learning so much so fast, usually on very little sleep, giving them resources, building their confidence, offering emotional support. It's critical. That parent-infant diet, the two of them together, that's the central unit. You support one, you support the other. It creates that nurturing environment the baby needs to thrive.
Wow. What an incredible journey through just 28 days. We've really unpacked the critical nature of this neonatal period, haven't we? We looked at common hurdles like jaundice, feeding issues, and highlighted just how vital both expert medical care and that deep parental involvement are. It's so clear this golden window isn't just about the first month. It sets the stage for, well, potentially their whole life. So thinking about everything we've unpacked today, from the immune system getting programmed to how bonding shapes the brain, what aspect of early childhood development or maybe parental support do you think is most often overlooked? And maybe why?
That's a great question. I think perhaps the sheer scale of the emotional and psychological transformation the parents go through is often underestimated, and their own need for really robust support during what can be a very intense, sometimes isolating time. We focus so much on the baby, and rightly so, but the parents are adapting, learning, growing incredibly fast too, supporting their mental health, their emotional well-being. That's a direct investment in the baby's future. It's truly a continuous journey of learning for everyone involved.
That's a really insightful point. For more in-depth information on all things neonatal care, other children's health topics, and comprehensive pediatric services, we absolutely recommend you visit omegapediatrics.com. It's just an incredible resource, really, for new parents, expectant parents. A wealth of knowledge and support there.
Yeah, definitely check it out. Lots of valuable insights from experts right there on the site.
And if you found this deep dive helpful, please do take a second to like this video, subscribe to our channel for more conversations like this, and maybe share this with someone else, another parent, a friend who might find it valuable.
We really appreciate you tuning in and thinking through this critical period with us.
Thank you so much for joining us on this deep dive. Until next time, keep learning, keep growing, and have more